Hello. So I'm Jen Horenjeff, founder and CEO of Savvy Cooperative, and I am super excited to be joined here by Fatima Paruk, who is the Chief Health Officer and SVP of Health and Life Sciences at Salesforce. And we are just coming off of listening to an amazing keynote session all about health equity. And so as a patient who really tries to make sure that we're creating more inclusive innovations, I really want to step back and understand, how did you get here? Why is this something that you care about?
Yeah, thank you so much for that question. It's so awesome to be here with you in person, actually having this discussion.
Yeah.
How amazing is that? And how amazing was the energy in the room today? I think as you think about equitable access to care, we are living in the era of the empowered consumer as a patient. People need to be met whenever and wherever they are as it relates to being able to get the care that they want and need. And this is just such an exciting time because we get to make that happen. To your question about why am I here? So one, I got to do that work, right? Somebody's got to do it.
Someone has to do it.
Got to be the voice of reason here. Coming from a clinical background, I am a physician. I get to be that voice of reason, and it's a pretty amazing thing to be able to really figure out how I impact millions of lives at a time every single day. I came to Salesforce about 9 months ago at this point. I had been through a lot of change in my life. I've had a very humbling experience of becoming a mom over the last year. And
congratulations, that's
much.
exciting.
Thank you very much. But going through that experience has been incredibly humbling because I have become a caregiver. I have figured out that I don't necessarily take as good care of myself as I potentially
join the club.
and I'm going through it like everybody else. And so just as I have sought to find care even for myself, I've just had some very interesting and potentially difficult experiences.
Well, my heart always goes out to those, especially those new parents. I think about my parents. When I was just 11 months old, I was diagnosed with multiple autoimmune conditions. And so thinking about, what you're even navigating, trying to advocate on behalf of somebody else, be it a child, be it parents, we're all trying to do that work, or yourself, to try to get that care. And as some of the speakers were talking today about how their technology, or Salesforce's technology, they're using within their own companies and systems to help improve this process, I was like fist bumping in the back, being like, yes, because as a patient, it's just so hard sometimes. Try as you might, you want to try to follow your care plan. As a physician, you're prescribing it. But as a patient, you're like, I'm trying, and it's so hard. So how can a company like Salesforce, and how can we use technology just more broadly to improve the experiences for patients and their family members?
Yeah, I think, just from an equitable access perspective, technology can be the greatest enabler. It can also be a barrier. Yes. And it's all about figuring out how we take the capabilities which exist today from a technological perspective and apply them to being able to create access to care, to being able to make our processes a little bit more frictionless, to make them easy, to get the job done, and to make people healthier and to keep them engaged over the course of their entire life, whenever and wherever they are.
Well, I know that Salesforce was announcing that they're going to be more involved in making sure telemedicine can be utilized more readily for patients as well. And it's something that, when the pandemic hit and telehealth was rolling out and we're like, oh my gosh, this is great. Patients have been asking for this for so long. And it took a global pandemic for us to finally remove the red tape, and off we went. So what are some of the things that you would like to see now that people's eyes are open to what it's like to be able to provide more access? What's on the horizon for you?
Well, I certainly think virtual is not going away. We are going to become a hybrid system of care, and that means, when I need to be seen over telehealth, great, I have the opportunity to be seen. If I need to be seen in person, I have the ability to very easily go online, schedule what I need to. I don't need an app. I don't need to authenticate 27 different times. I just have the ability to go ahead and get what I need when I need it. I also think that in this era of the empowered patient and, quite frankly, the empowered caregiver, we need to explore different avenues for receiving care. So it's no longer just virtual or just in a clinic or in a hospital. It now is wherever the heck we are. So that may be in a retail clinic or in our community or wherever we are, again, on a plane, on a bus, on a train. And it's pretty amazing that we have the ability to do that in this day and age.
And what I'm hearing from you is that personalization. You choose your own adventure for healthcare as much as somebody can do. And that's what in our work at Savvy, where we're talking to patients all day long, it's really what they're talking for. Patients are not monolith. They have preferences, they have different schedules, they have priorities and other responsibilities. And so the more that we can enable them to actually choose what's right for them, the more we can actually empower them to take care of their health.
Yeah, and I am such a proponent of figuring out how to meet patients where they are, right? Ultimately, we all have incredibly complex lives and very different needs in different stages of our lives, right? A child will have a certain set of needs. A child with health conditions will have a certain set of needs. And then sometimes, you kind of go through this middle section of your life where maybe you're a little less high touch and you're just trying to get on with it all, but then you kind of get a little older. And as you age, you have a number of different chronic conditions that all need to be dealt with. And so again, I think figuring out where to meet people where they are and how best to do that, given the stage of their lives and all the other things that they have going on, including addressing their drivers of health, will really start to really ensure better outcomes.
Yeah, and I can't wait till we can get there for that personalization. So to close out, I want to understand from your perspective, as somebody who's been ingrained in doing this kind of work for years, you've been advocating McKinsey and Microsoft and really these companies that have such a global reach to make an impact. What are we looking at in the future here? Where can we go?
It's a journey. It is absolutely a journey. I will argue that we are currently in our infancy as it relates to just the pathway towards ultimately achieving health justice.
Yes.
We have started at Salesforce within our own employee population. We're taking a really good hard look within and trying to identify sources of inequity and using that as a platform to say, hey, this matters, and it's not a you problem or a me problem, it's an everybody problem. From there, we hope to create amazing partnerships and work with a lot of our existing customers and new ones to figure out how to innovate together to solve for this problem. We are very much committed to being equitable by design. We spoke a lot today about some of the accessibility and some of the ability to identify those patients who are at highest risk. And that will continue, and that will continue to evolve. And again, it's all about getting there together. No one group is going to figure this out alone. We live in a global economy, and we're only as good as our sickest and our most vulnerable.
And we have to help them. And I mean, I couldn't agree more. Our purview is, yes, we are going to accelerate more inclusive innovations if we actually co-design those solutions together and come together. Let's all not forget why we're here. It's to solve these problems, to improve patient lives, and we need all of our different levels of expertise. And here at Savvy, we want to make sure that patients' voices are being heard within this. And I think that for folks like you and so many of us here at a meeting like this, let's recognize the privilege that we have to even be having these conversations, to be showing up in these meetings. And so I thank you for using your privilege to impact the work that you're doing at Salesforce, but we both know it's beyond that. And that's why you got into this work, is to have that impact. And so I'm so grateful for you.
And I'm grateful to everybody that I get to work with. I'm grateful to our patients. I'm grateful to our customers. I'm grateful for everybody who's innovating together to solve for this.
Well, clearly we have a mutual appreciation here. So grateful for the work that you're doing and for how Salesforce is impacting the lives of patients. We know technology is the way. It's going to accelerate this. It's not the only thing, but it's certainly going to enable us to make some of those changes for that personalized care. So thanks so much for joining us. And we've had this fabulous chat. Thank you, Fatima, for having our conversation today and for all the work that you're doing. And we can't wait to look forward to see what you're doing next.
I'm looking forward to chatting again soon.
Thanks so much. And to everybody else out there, don't forget that when you are doing your innovations, think about how you're asking patients so that we can create more inclusive innovations of the future. Thanks so much.